If you have Crohn's disease and ulcerative colitis and are sexually active, then choosing the right type of contraception is really important because, believe it or not, having IBD can make some contraceptives less effective. So if you want to know how this is even possible and which contraceptive options are best for you, then stick around. Hello, welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information. So make sure you hit that subscribe button and the bell to be notified every time I post a video. And if you want to join an exclusive community of people who receive tips and tricks on living with Crohn's disease and ulcerative colitis, make sure you sign up to my newsletter by visiting the link in the description box below. So without any further ado, let's just get straight into things. If you are sexually active, then it is important to use contraception not to only prevent unwanted pregnancies, but to prevent spread of sexually transmitted diseases. Getting pregnant if your Crohn's or colitis is still active, or being pregnant when taking certain medications for your IBD can cause problems for your own health and for your child's. To find out more about if pregnancy can make your IBD worse and if it is safe to take IBD medication when pregnant, check out these two videos and the links to those are in the description box below. Probably the most reliable option is using what is known as barrier contraception. This includes condoms, cervical caps, contraceptive sponges, and these all help prevent sperm from entering the woman's uterus. Some of these barrier methods contain spermicides, which is a name given to something that kills sperm, but some don't, and so you may need to apply it yourself, for example, when using a diaphragm, which is a form of female barrier contraception. Things get a little bit more complex when we start talking about the combined oral contraceptive pill and the progesterone-only contraceptive pill, because IBD can make them less effective. Now, depending if your Crohn's disease affects your small intestines, you will have something known as malabsorption, which is a way of saying less of the nutrients from your food you eat is absorbed because due to the disease area impairing absorption. When you're on the pill, your body absorbs it in the same way as it does with food, and so not all of the pill may be absorbed in women with Crohn's disease because of this malabsorption. The same applies for you if you've had surgery and you have had some of your small intestine removed. Because there is less of it, there is less of a chance the entire contraceptive pill will be absorbed by your body. Now, care should be taken if you are in a flare and experiencing vomiting and diarrhea while on the pill, because this will also reduce the amount that your body is taking in. If you are using contraceptive patches, injections, implants, or the coil, then these should be fine even if you have IBD because their effects are being applied directly to your body and not relying on your intestines to absorb them. Another option, which may not be for everyone, but some people who have decided that they either don't want kids or have had enough of kids, may choose sterilization. Now, this is having an operation that prevents pregnancy as the fallopian tubes are tied and blocked to prevent sperm reaching the eggs and fertilizing them. If you are not sure which contraceptive method is best for you, please discuss this with your doctor and IBD team before choosing, or if you are already on any of the contraceptive methods and wonder if it's the right one for you, then also discuss this with your doctor. So that's a very brief summary of the type of contraceptive methods that are available to you if you have Crohn's and colitis. So now make sure you check out these videos for more useful tips, tricks and information for Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this and found it useful. And I can't wait to see you all in the next episode.